My name is Pavlos Vlachos. I'm professor of mechanical and biomedical engineering. I'm also the director of the Regenstrief Center for Healthcare Engineering, and I also have the St. Vincent Health Chair for Healthcare Engineering at Purdue University. The hypoplastic left heart syndrome is a very complicated disease, and most babies actually they don't survive the first year of age. In order to survive, they need to have a surgery literally within days, within the first week since the day they're born. In order to best inform those surgical decisions, the surgeons need information that currently is not available to them. They need to understand in utero, if possible, how that heart functions and try to predict the outcomes of the surgery and how the patient is going to do in the future. So in other words, what we're trying to do is we're trying to help the surgeons make the best surgical and treatment planning decisions for the patients as early as when the baby is in gestation. Generally, when a fetal echocardiogram is done and is analyzed, normally they analyze it for the shape and looking for very general malformations, like if there's a hole in the heart or some other type of abnormality. But the heart is really a pump. It has to pump blood to the body, has to suck blood from the lungs and push it to the rest of the body. And in order to do that, it's not only the shape that matters, but it's also the function. It's the pressure that it generates. It's the energy with which it works. So in order to better assess the heart function, you need to know also these parameters. Our tool essentially fills that gap. Normally, the standard analysis does not provide any of that information, but with our technology, we can provide the surgeons an understanding of not only what the heart looks like, but also how it functions. So our tool is based on three basic modules. Our first module is analyzing the chambers of the heart and the shape and trying to look at the basic geometry that the heart has. Then the second tool is looking at the deformation of the heart, how the heart expands and contracts. And the last one is looking at the flow, how the flow enters into the chambers of the heart, how it comes out, and what are the energy losses or pressure generated within that flow pattern. So our tool is not limited to hypoplastic left heart syndrome, but it can be used to analyze other types of congenital heart disease, including, for example, tetralogy of Fallot, also known as the blue baby syndrome. Also, it can be used to analyze other childhood cardiac conditions, like, for example, hypertrophic cardiomyopathy, which is the condition when, for example, a teenage or a child athlete will collapse during practice because of a heart failure that has gone undetected. Beyond that, we can also use our tool to analyze adult cardiac conditions, including, again, for example, congestive heart disease, which is very common to people above ages of 65 with obesity or diabetes. So generally, our tool can be applied across the spectrum of cardiac conditions. The fetal and hypoplastic left heart syndrome are, by most accounts, the most challenging imaging conditions we will encounter. They have the most strenuous conditions in terms of image, noise, and resolution. If our tool does well under those conditions, then we'll do just as good, if not better, in all of the other conditions.